Welcome back to Good Day Stateline. Dr. Kapoor is joining us this morning to tell us about what's new at Transitions Hospice. Good morning.
Good morning.
Thank you so much for coming in.
Thank you for having me.
So tell me about yourself and how you started working in hospice.
Yes, so I am an internal medicine physician who is fellowship trained in geriatrics as well as hospice and palliative care. And I worked in hospice. It really was a natural evolution. I was always in nursing homes with my mother, who worked in nursing homes as a child, so there was a natural inclination toward geriatrics.
Sure.
And then I decided that I was comfortable there and I wanted to specialize in geriatrics. And then I started noticing I really enjoyed easing suffering of people, whether that meant in the physical realm or in the spiritual or the psychosocial realm. So palliative care and hospice was a really good fit for me to complete that circle.
Yeah, and so Transitions Hospice, you have a couple locations, correct?
Yes. We are located in Illinois. We're located in Huntley,
okay,
Rockford, Naperville area, and we also have offices in Indiana.
Oh, perfect. So many different places where you can get information about Transitions Hospice, where you can go there if you need to. So
and
tell me.
Champaign and Peoria as well.
Yes. So even more.
Yes.
So you're talking about the difference between hospice and palliative care. So what is the difference and what do people think?
Right. So there is a difference between hospice and palliative care. Typically, patients that are on palliative care, we are there to delineate what their goals are from the start of the illness. And how that looks is we can see these patients in the hospital, a nursing home, or in a home setting. And it's covered by Medicare Part B, and most insurances cover palliative care. It is meant to be an adjunct alongside the primary care doctor or the specialist seeing the patient. And the idea is to reduce readmission to the hospital, to give them a better quality service in terms of attention to their real needs, advocacy for the patient, looking at what medications are really helpful here based on what their goals are. We do advanced care planning within the consult as well. And what we find is that every palliative care consult actually saves $3,000 to the healthcare entity because we get to that patient before they're hospitalized. It promotes quality of life and extent of life in certain disease processes too.
Okay, so and what's a misconception that people have about hospice and palliative care?
Right, so the misconception is that when a patient reaches hospice, which is the terminal 6 months or less prognosis, and that comfort is better than being curative at that point in the disease, that, you know, really we want to squelch the misconception that giving medication at the end of life is causing the death, right?
Sure.
Sometimes people think morphine equals death, but in fact, it's allowing the patient to relax. It's a pain medication. It gives them euphoria. So the reason that's a misconception is because people come onto hospice too late. In this country, the average is about 9 days to death, which really speaks to the fact we have to educate the primary care physicians and the ancillary healthcare staff to get the patient into a palliative care program at the right time, earlier, when they're getting into the hospital more, when their symptoms are going up in that advancing illness. Then we can transfer them onto hospice so they actually get the benefit.
For sure, and you're talking about some of the things that Transition does, like massage therapy and music therapy, so tell me about that.
Right, so just in fact, we ordered massage therapy for a patient that we felt would benefit from it for her pain this past week, couple of patients, and you know, non-pharmacologic pain management and anxiety management should be utilized and integrated into the work that we do. So that's the idea. Music therapy, music has been known to enhance not only the experience, but mitigate the anxiety in a dementia patient. So integrating these types of evidence-based modalities such as guided imagery, aromatherapy, CBD oil, medical marijuana allows the patient to be awakeful more at the end of their life than giving them sedating medication. So it's good to be with a company that's knowledgeable and educated about it.
Okay, so for anyone who wants more information from you or about Transitions Hospice, where can we go?
Well, you can come and call our hotline, and so we can provide that to you for your website. So transitionshospice.com is where you can get that information as well.
Perfect. Thank you so much for stopping in this morning
Thank you for
and talking to
having
us
me.
about all of this.